joining. We are just going to wait a moment to let more attendees join before we'll get started. So thank you. Great, hello. Thank you everyone for joining us for today's event, Delivering Mental Health Care for All, Why Investment Now is Crucial. I'm Kate Warren, Executive Vice President at Devex, and I'm delighted to moderate today's discussion. So as we gear up for World Mental Health Day on October 10th, Devex is honored to partner with the Global Mental Health Action Network to host this series of discussions on the importance of mental health for productive and healthy societies and how to ensure investment in mental health, particularly as we see an increase in mental health needs as an impact of COVID-19. COVID-19 has put a huge strain on the mental health of individuals across the world, dealing with both the public health implications of the pandemic and just the increased stress from its negative economic and social consequences. I think many of us are perhaps more keenly aware than ever of the importance of mental health as we all grapple with our own and our family and loved ones and having access to services and care and how critical that is. But despite increased awareness, a large funding gap still needs to be bridged before we can guarantee mental health support for all. It's something else this pandemic has really put into stark light. So building upon a previous discussion from the 75th UN General Assembly, which explored the role of mental health in advancing the SDGs and the need to integrate it into universal health coverage, today we have convened key experts and advocates to discuss how to build on this momentum and ensure more investments in mental health, and also some new data on the impact COVID-19 has had globally on mental health and what more needs to be done. So you will get to be some of the first to learn key findings from a World Health Organization report launched just yesterday, illustrating how COVID-19 has disrupted both availability and access to mental health services and how countries across all regions and different income groups have been affected. We hope you'll join in on the conversation by sharing your questions in the chat box. We'll keep an eye out for them and ask them as time allows. We also encourage you to participate in some audience polls that we have planned so we can take a pulse on what you think and about these challenges and opportunities. So to get started, I'd like to introduce our first guest, Raj Mariwala of the Mariwala Health Initiative and Global Mental Health Action Network Advisory Board member, to discuss the global health community and how they are working together to call for change. So Raj, thank you so much for joining us today.
Thanks so much, Kate.
Yeah, go ahead.
No, go ahead.
Well, we are delighted to partner with the Global Mental Health Action Network on these important discussions on the critical importance of mental health support. For our audience who isn't as familiar with your organization, can you share a little bit about what you do?
So you're asking about the Global Mental Health Action Network?
Yeah.
Right. So the Global Mental Health Action Network is an advocacy and communications coalition with about 1,000 members from 78 countries. Now, these members comprise of representatives of governments, international organizations, academia, non-governmental organizations, as well as the private sector. Now, this group exists because there is a massive need for a collaborative movement in mental health. And not just a collaborative movement, but a movement really that's sustained on allying, sharing learnings, and building solidarities really to visibilize and galvanize action on mental health. So the network operates on principles of openly sharing plans, opportunities for collaboration, as well as working with other members and stakeholders towards joint activities to increase the impact of global mental health advocacy, communications, and financing. And this, of course, becomes more relevant at the time of international meetings, such as, around World Mental Health Day. So just to give you an example, currently GMHAN has working groups for youth and child mental health and mental health financing. And more recently, we produced a briefing for members of the United Nations Global Assembly, General Assembly, sorry, and a toolkit for World Mental Health Day. For anyone who wants to find out more information, I'm going to share a web link if you would like to join, or an email address that you can reach out to for more information or questions.
Great. Yeah, thank you. And we can share that link in the chat for our audience who would like to learn more about that. So in addition to your work with the GMHAN, you're also the director of the Mariwala Health Initiative, working with communities to provide greater access to mental health services. So kind of from both of your peer views of working with the Action Network and the Mariwala Health Initiative, how have you seen the mental health needs changing as a result of COVID-19, and how is your organization responding to that?
So, as we all know, COVID-19 threw up fault lines in our systems. It already taxed struggling public health systems worldwide. And so for us here, I think it's been quite illuminating, and hopefully more people will understand that there is an intersectional and an intersectoral aspect to mental health, that it is connected to issues such as domestic violence, it is connected to other economic, social, political issues, such as who gets access and who doesn't. And so it's been very important for us. Yes, COVID doesn't discriminate, but unfortunately, our systems do, due to lack of accountability, transparency, and of course, investment. So I think that's been the bigger learning.
Yeah, I mean, as you mentioned, I think perhaps more than ever, people maybe who have overlooked the importance of mental health are talking about now, as maybe they themselves or loved ones are facing challenges as a result of the pandemic. Imagine this must include some leaders too. Do you think that this is kind of a moment maybe of renewed empathy that could help spur action and commitments? Are you seeing a response as more people are perhaps aware of the importance given this moment?
So I do believe that, unfortunately, at the very beginning of COVID, there was actually an increase in stigma, and I think a lot of people may disagree with me, but the fact of the matter is, whether it was in the US with regard to Asian Americans, or whether it was in India here with regard to Northeast Indian persons, there was a rise in stigma. And so I think it's very important to center that and to say, yes, there has been a rise in stigma and discrimination, which should actually intensify our efforts to look at mental health from a rights-based perspective and to spur investment in mental health from a variety of sectors, and engagement as well with a variety of sectors such as human rights, for example.
And so, what is the global mental health community calling for and run up to the World Mental Health Day this year? What is your call to action?
Right. So the theme for this year is Move for Mental Health, Let's Invest. And the aim is to have mental health for all, because greater investment equals greater access. Why is that? Because there's just not enough movement on mental health. There's not enough movement on mental health investment, not enough movement on mental health access, and not enough movement on each and every person's right to good mental health. 1 billion people across the world are thought to live with a mental health issue. But due to historical, structural invisibilization and discrimination, we don't hear about that as much. Those who live with severe mental illness die 10 to 20 years earlier than the general population, and that's primarily due to physical disease. We lose lives of about 800,000 people every year due to suicide. And that tells us that mental health contributes to 31% of the global impact of global disease, but receives less than 1% or maybe 2% in developed countries from national health budgets worldwide. There are serious gaps that exist in mental health care, and they are a result of historic underinvestment in and action on mental health promotion, prevention, and care. And this combined with the stigma, the discrimination, punitive legislation, and human rights abuse really increases the urgency to improve access to and investment in mental health care for all.
Right. Well, thank you, Rajan. We'll get into some ideas on how we can see more action and commitment a little further in our conversation today. Again, if you're interested in learning more about the Global Mental Health Action Network and how you can get involved, we'll have a link shared with you all in the chat box.
Yes.
So again, thank you. Thank you, Raj, for sharing more about the work that you're doing. So I promised you would get to be some of the first to learn about a new WHO report that was just released yesterday. So I'd like to invite my next guest, Devora Castell, who's the Director of Mental Health and Substance Abuse at WHO. So WHO has conducted a rapid assessment of service delivery for mental, neurological, and substance use disorders during the COVID-19 pandemic. And this is a survey of 130 countries and really provides the first global data showing the devastating impact of COVID-19 on access to mental health services, really underscoring that urgent need for increased funding that Raj just stated. The report details how countries and regions and different income groups have been affected and proposes what needs to happen next. So Devora, I'm eager to learn more about what you found, and thank you for taking the time during what I'm sure is a very busy week for you with this report coming out to share these insights with us. Devora is going to share a presentation with some of the findings, and during that, if you have any questions, feel free to enter those into the chat box and we'll try to get to a couple when she concludes. So Devora, thank you for joining us today.
Thank you, Kate, and thank you, colleagues, for this opportunity to share with you the findings of the report. I understand that somebody will go with the slides from your team. Yes, I see them preparing. Thank you very much. So we will show them the impact of COVID-19 on mental, neurological, and substance use services and the results of the rapid assessment. If we move to the next slide, please, we see that we know the importance of mental health in general. We are talking about nearly 1 billion people affected by mental disorders, and we know that during crisis, emergency situations, more than 1 in 5 people will be affected by mental health conditions. And that means, in many cases, human rights violations, stigma, and discrimination coming along with the condition. And what was just mentioned earlier, the chronic underfunding of mental health, when we know that the burden is huge, the numbers in general are big, but the funding is very small. So in recent months, since the pandemic was declared, we have come up across with a number of opportunities to highlight at a very high political agenda the role of mental health, the policy brief of the United Nations Secretary General, but also in the context of the Global Humanitarian Response Plan, mental health and psychosocial support is included, has been included. And however, we see that that inclusion do not necessarily is reflected in what is actually happening at country level. So the next one, please. We will then run this rapid assessment. We understand this is the first attempt to measure the impact of the pandemic on mental, neurological, and substance use services. And you will hear me repeating this maybe a few times because we try to be comprehensive. So we reach out to all the ministries of health that are part of the World Health Organization, that is 194 countries. And we got the survey completed by appointed national mental health focal points from 130 countries. And it was a web-based questionnaire in our official 6 official languages. And the survey was run between June and August this year. We have then the data presented. You can look at the report is by region, WHO region, but also by World Bank Income Group, because and also by COVID-19 transmission stage. It will give us different perspectives. The next one, please. As I said, had this 130, 60%, 67% of countries that responded, and you can see they are divided by region: African, American, Eastern Mediterranean, European, Southeast Asian, and the West Pacific region. We use our own acronyms here. That is the percentage of response by region. Some of the limitations you have listed there. The answer was provided by one person that in some cases was very well informed, in some cases maybe not very well informed, in some cases the representation, the information is centralized, which means that we really do get the national situation. In other cases that may not be exactly the case, and in general we know that mental health information systems are very weak, and this is then reflected on any kind of survey you want to do. The next one, please. So we have, I would say, a very good surprise. At the first one is that 89% of the countries reported that mental health and psychosocial support is an integral component of the COVID-19 national response plan. So in almost 90% of the countries, this area is included in the plan. And in 2/3 of the countries, the answer, the feedback we got is that there are mechanisms for coordination of mental health and psychosocial support in place. The next one, please. Now, the not so good news then is that from those 89% of countries who do have the mental health and psychosocial support plans incorporated in their national response plans to COVID-19, only 17% have ensured additional funding for those activities. And you can see the distinction here if we talk about low-income countries, where only 7% of countries have some extra funding, to high-income countries, where you see 26% of countries having extra funding. But in total, in any case, even for high-income countries, the funding to support the implementation of those plans is quite small. The next one, please. We have here then the situation specifically about whether services were disrupted or not, and by how much. And we see that on one hand, 91% of countries have included mental health service, mental health, neurological and substance use services in the list of essential services, which is of course very good. But in the meantime, also we see that only 7% of countries have said that there was no disruption at all in the services. Now, this maybe deserves a bit of further comment, if you allow me, because we know that in many countries, the services are mostly based on mental hospitals, psychiatric hospitals, and so those were the services that were less disrupted. Most of them continue with their function. But when we have countries with a variety of services that are going from hospital care to community care, that is when we see then 93% of those countries have services disrupted. And you see, I hope you can see at the bottom of the slide, the services that were listed. And then the outpatient services in mental hospitals and in general hospitals, as well as the community-based services, were those more affected, more disrupted. The next one, please. We have another interesting piece of information is that services for emergency on one hand were affected, emergency interventions were affected. And when we talk about emergency interventions, you can see also there in the slide, we are talking about services for some epileptic situations, withdrawal from substance use, and also some other issues related with risks of suicide that are the services usually the attention usually provided on in these emergency services that were now disrupted. And then we see on the other hand these services for vulnerable groups that were affected between 60 and 70%, 72% actually, services for women and requiring antenatal care or postnatal care, older adults, children and adolescents. Those were severely affected at the time when we know those are the services perhaps more needed. And this is something I want to highlight. We talk about community-based services, we talk about promotion and prevention, we talk about services for children, adults, and women, prenatal or postnatal, that need support in current situation are among those more disrupted. The next one, please. We have tried to find out what are the alternative options that countries have identified. And you can see here 70% of countries have make use of telemedicine and teletherapy. 68% have used helplines for mental health and psychosocial support. 60% of countries have provided some kind of training on basic psychosocial skills to the health personnel, but only 38%, so a quite low number, have provided or have made use of task sharing and building the capacity of health personnel to take care of mental, neurological, and substance use issues, or people with these issues. The next one, please. We then definitely need to have better surveillance and more research. We understand that only, sorry, half of the countries are responded that they are collecting data on mental, neurological, and substance use disorders or manifestations in people with COVID-19. Only 2/3 are saying, are reporting plans for studies related to the impact of COVID-19 on mental health, but only 1 on 10 are researching the impact of COVID-19 on brain, which is quite a small number. And the next one, and last, we see from this preliminary analysis 3 priority actions. The first one is clearly the need to allocate funding resources that will allow countries to implement mental health and psychosocial support as a real integral part of the COVID-19 response and recovery plans for countries. The second one is to make sure that essential mental health and neurological and substance use services are included as part of the essential services that countries are planning, with the adaptations that are recommended and the guidelines that we have issued a couple of months ago, available for consultation and adaptation to local context. And the third component is that we need to countries need to strengthen the monitoring and the changes in services organization, distribution, and assessing what is happening in order to be able to continuously adapt and plan according to the needs. And with this, then I'm finishing the quick summary of the report that is available. Maybe we will put the link at some point in the chat box. Thank you very much.
Thank you, Deborah. Yes, and we will try to get that link. And I know several people are eager to to read the report and dig into those findings. It seems there are some pretty sobering as well as maybe some encouraging numbers in the report. I'd love to know what if anything surprised you and what you hope to see as a result of getting this data out there. Sorry, Deborah, I'll bring you back in for a couple of questions.
Thank you. I couldn't unmute myself, lost independence. And my video as well. Okay, so you can see me. Well, we hope to see what I summarized a bit in the last slide. I mean, we have an increased attention and interest on mental health more or less everywhere, but this is not reflected in the support that countries need to put the services that are needed. We have heard different experience from different countries, from high-income countries, from low, middle, or to low and middle-income countries that tell how colleagues, mental health professionals, have been struggling with the current situation. And what is interesting is that there is information of what needs to be done. There is knowledge of that's the word I was looking for. We know what needs to be done, but it's still not happening. So we need the support from senior officials, from ministries of health and other sectors to support this development at country level.
Great, well, thanks. I'm going to put you on pause here for now. I know we're going to invite you back later in today's session to dig into this a little bit further, but next I'd like to welcome our next guests. So we have Cecilia Vaca-Jones, who's the Executive Director of the Bernard Van Leer Foundation. We have Shanta Rao Barriga, the Disability Rights Director for Human Rights Watch, and Godfrey Kagai, a member of the Global Mental Health Peer Network. So thank you for joining again. Thank you to the Global Mental Health Action Network for partnering with us on this event. It's a really important discussion today. So, October 10th is World Mental Health Day, as we've discussed. And this year, the theme is investment and access. Devorah just shared some, maybe dire, but also encouraging statistics on what the current state of play is. I'd like to first just do a round robin and see what each of our guest reaction is. Are there any surprises or key takeaways or findings that particularly resonated with you and your work? And let's see, I'll start with you first, Cecilia.
Thank you, Kate. And I think I would also thank Deborah, because it's always nice to have some real data of what's happening in countries. And in the Bernard Van Leer Foundation, we work with early childhood development. So we're mostly interested in the mental health perspective, just because we are aware that if we're able to promote positive caregiving, then we're able to have positive development for children, and especially for babies and toddlers. And what we've seen in most of the countries that we work is that even though countries seem to show a lot of responsiveness to mental health services, the access to actual services is quite limited. And I think that's also reflected on Deborah's research study at the moment. So I think it's actually quite nice to see that the data is backupping some of the hypotheses that we have of the work that we do in countries. But let me stop there just to get this initial insights, and then I'll give you more information on what we do.
Right, thank you, Celia. Godfrey, your reactions to that? Great, we can hear you. Godfrey, do you have any reactions to the report findings?
Well, thank you very much. I'm Godfrey, and I'm a member of the Global Mental Health Peer Network. I'm joining you right from Kampala, Uganda. I must say that this has been an elaborative report I've picked quite a number of lessons and still learning from it. I think at this time I'm not in a position to give any feedback. I'm still digesting the report.
Yeah, there's a lot in there. Shanta, how about you?
There is a lot, and it's an impressive report, especially because I think there is a lack of data on so many areas related to mental health. One thing that struck me was the point that you made, Devora, about how there's a disruption in services to such a high degree. I think it was 93% of community-based services. And that's something that many of us advocates and people with lived experience have been pushing for. There should be community-based services. And yet in a pandemic like COVID, you see how when those are disrupted, what can happen and what's the impact on people, particularly with mental health conditions. And I'll talk in a little bit about a new report we launched today, but we've been working on this issue of shackling, where people with mental health conditions are chained. And what we found is that the consequence of the breakdown in services is that people have gone back to chains. People who had been released and were getting support and services in the community are instead now locked up again, or chained or hidden away. And so there are really concrete impacts. And I just found that really striking to see that number and to see you quantify that in that way with the 93% of community services.
Well, yeah, and I think, so you said before, many of us are really keenly aware of the impact of mental health given the COVID challenges. So I want to throw a poll out to our audience and ask, how has COVID-19 impacted the mental health of people around you? So encourage you to answer that poll, and we'll in a moment look at those results to see what our audience is feeling. But let's see. Godfrey, let's move on with you. And you mentioned you're part of the Global Mental Health Peer Network, a community of people with lived experience who can support each other around the world. So what has been the impact of COVID-19 on people with lived experience? And why is it important to include people with lived experience in discussions around design and delivery of mental health services?
Well, thank you very much. Like I say, some of the previous presenters said, COVID-19 came in a time when no one was prepared. And it has affected us a lot, not only to the person with lived experience, but COVID-19 has affected each one of us in our spheres of life. Having said that, specifically to the people with lived experiences, how it has affected, one, COVID-19, when the pandemic was declared, a number of governments came in with a number of safety measures, and one of them here in Uganda was declaring a total lockdown of the economy. No public transportation to health facilities, the businesses were closed. That affected a lot, because you find those people with lived experiences who seek medication from health facilities, they were not able to move to get drug refills. But also too, COVID-19 really torn families apart in one way or another. You find, for example, myself, when the lockdown was declared, I was away from home. It took me nearly 2 months to get back to be with my relatives back home. Throughout that period, it was really very tense. Being isolated, you have no one to talk to. That was really traumatizing, not only to me, but also to other people. Another question, why I think people with lived experience needs to be included in the design of mental health services. One, I think, like you said, people with lived experience, they know what it means to have a mental health difficult, how to cope through such challenges. So I think if we are to design services, comprehensive mental health services that are really to address the needs of people with mental health challenges, we must include them. One, they have the experience, but two, they have knowledge about the conditions and what can help them to overcome such challenges.
Yes, nothing about us without us is a common refrain that I think is really important. I'm hoping my colleagues might be able to share with me the results of the poll. I see it just popped up now. So how COVID-19 has impacted the mental health of our audience. Coming in first was more people are willing to talk about their mental health needs and challenges. So we talked a little bit about the stigma and whether or not COVID-19 has maybe increased or decreased. So interesting to hear that, followed by the mental health of those close to me has worsened. So we also have high up there, I know people who've been unable to access the services they need to support their mental health. And only 8% are actually seeing that, this working from home, this new world has made it easier to look after their own mental health. So interesting findings there from our audience. So Cecilia, going back to you at the Bernard Van Leer Foundation, you prioritize early childhood development and also the importance of caregivers, including parents. We learned in the WHO report that I think it was 72% of children and adolescents saw disruption to their mental health support services. So maybe you can talk a little bit more about how these groups have been affected by COVID-19, and also in particular why mental health of caregivers is so important for us to focus on.
Thank you, Kate. And I must say that what it's been really interesting about this pandemic is actually understanding how this is affecting everybody, but in particular, when you think about babies and toddlers, and here's where the role of caregivers is so important, we're thinking about how this is affecting the relationship and the positive interactions between caregivers and babies and toddlers. And maybe let me share my screen because I have 2 or 3 pictures that I think can be very powerful in just like explaining and expanding this understanding of why the mental health of caregivers is so important, especially in the 2 first years of life. Can you see my screen now?
Yes.
Perfect. So actually, when you see this picture, which is from the very beginning of life, the fact that a mom has this stability to actually get an immediate connection with their babies, this is a great example of just showing how important having this internal mental health that allows to project these positive energies and these positive connections to babies is so important. And this is something that might be limited with the whole pandemic context, just because many pregnant women cannot access the services, or sometimes they can access the services, but everything that they're leaving, in many cases, they're leaving grief, they're leaving concern because of their economic situation, because of the lockdown, because of some of the measures that have happened during the lockdown. So there are many different situations that are putting a lot more stress on pregnant women. So this positive interaction that is so important from the very beginning might be affected just because of the condition of the whole pandemic. But maybe let's see some other examples, and I'm just sharing a couple of pictures here because I think that sometimes when we talk about this social distance, which has been like a general rule in the pandemic, we're not really thinking about which is the real effect on the social connections that are so important at the beginning of life. And what I'm trying to express through these 4 beautiful pictures, which are very different pictures from very different contexts, is the importance of really enabling this positive interaction. So on your left, you have the picture of a caregiver, which is not necessarily like a mom, but in this case is a health worker visiting a home of a recently woman who had delivered a baby. And in most cases, what we've seen with early childhood development, and especially in the very early years, is that a lot of these home visiting programs have been disrupted. So they're not doing any home visits just because of the lockdown. And this has a negative effect because many of these women and caregivers need this support in order to be able to deliver these positive interactions. Again, this can happen in the services as well. And as I was saying before, we've seen there's a lot of limitation to the access of normal services when we're talking about babies and toddlers' health. And a lot of these interactions may happen and can be stimulated from the services itself. Or we can also think about what's happening in the public space. And if you think about a lot of the reports on what's happening in many cities, even in this recovery times of COVID-19, what we're seeing is everybody's speaking about what's happening with schools, what's happening with work, but not everybody's talking about what's happening with babies and toddlers. Are they really using the public space? Are they using the transport? Are they going outside? So what's happening of this connection that babies and toddlers need to have to their immediate environment in order to develop this positive neurological development? And maybe let me share these two pictures because I think this is quite powerful evidence. So the picture that you have on top of this brain, which is on a surviving mood, is basically the real picture of a brain that hasn't actually had access to a positive stimulation, that has probably not been nurtured or hasn't had access to a good nutrition. So as you can see, the neurological connections in this baby's brain is very limited compared to the picture below, which is the picture of a thriving brain, where it's basically showing that positive connections, good nutrition, good connections with the environment and the external factors affecting this interconnections in the neurological development of a brain of a baby are very positive. So of course, what we want to stimulate in every case is this positive connections that can basically help a baby thrive, but can basically promote all of these positive connections. And let me maybe just finish with this last picture on what are we talking about, like the importance of caregivers and the influence that they have in this very first period of life. I think this picture is trying to express that is caregivers need to feel that freedom to connect with their babies. And a context like the pandemic is giving a lot of limitations of how these positive connections happen. Maybe let me stop there just in case you have other questions.
Yeah, thank you. I think any of us who are parents can definitely resonate as we worry about our own children, and particularly, for some of us that are very lucky with access to a lot of services and support, can only imagine what it's like without some of those enforcements in place. So those are some powerful images. Thank you for sharing. So maybe just follow up, where do you see the biggest gaps in financing and maybe biggest barriers to increased investment in providing more support to children, adolescents, and their caregivers?
I think the biggest gaps, I mean, we have like evident gaps in financing mental health in general. And when you go to the specifics of what are the specific requests that, for example, pregnant women or women who have young babies need, then you see there's more limitation to actually allocate in specific resources or specific services that can basically cope with the demands of, for example, young mothers that have depressions. And we've seen a lot of this, for example, and we support a lot of governments do home visiting programs, where basically a lot of these programs target the poorest families in the country. So for example, in the case of Brazil, Criança Feliz is a program that visits the families that get cash transfers. And one of the problems is that many times you can have these home visitors basically address the needs of the families, but if there's a mental health issue, there's a lot of limitations of referring these cases to the mental health services. And if you do refer these cases to the mental health services, sometimes the services are not ready to cope with this kind of specific request of maternal depression. So I think depending on the country, there are many differences, but I think that the general gap is that we're not seeing the specific needs of caregivers who are struggling with what raising a young child involves. And I think in the given context of the pandemic, it gets even worse because caregivers are not just like struggling with all the caring activities, which demands a lot of a human being, but they're also struggling with all these other issues around the pandemic itself, about work, about not being able to have a baby supported by a specific service and you having to do all the caring activities. They're struggling with economic issues. So all of this stress is adding to the stress and the interactions between caregivers and babies. And many times all a baby and a toddler needs is this buffer person that can actually support them in a way that you can basically just like support that baby despite whatever's happening in their immediate context. And I also must say that one of the other important learning for the foundation has been one of the biggest gaps is also all the mental health support that caregivers living in a humanitarian setting are getting at the moment. I think there are a lot of gaps there because in the humanitarian settings, they're probably centering a lot of resources in other type of services, or they're dealing with mental health issues, but at a different level. They're not seeing what's happening on this strong relationship between just curating the mental health of caregivers, and in that way you can have a positive impact in the well-being of babies and toddlers.
Great, thank you. Shanta, you alluded earlier around some of the work that you're doing. I think we recognize the impact and damage when mental health support is overlooked or ignored, but there are some real human right atrocities when mental health treatment can take the form of abuse. You've done a lot of work in raising awareness around the shackling of people with psychosocial disabilities, which you mentioned, and I think you just releasing a report today, I think Break the Chains campaign. Can you maybe talk a little bit about that and the work you're doing in that area?
Yes, thanks so much, Kate. Yeah, today we launched a global report, the first of its kind, that documents that hundreds of thousands of men, women, and children as young as 5 years old have been chained or confined in small spaces like a goat shed or a small room for weeks, for months, and in some cases for years. And many of them are forced to eat in this small space, to urinate, to defecate. It's where they spend their entire lives. And why is this practice happening? It's really because of a lack of investment in mental health services and widespread beliefs that mental health stems from being possessed or cursed or having sinned. And so we've teamed up in the spirit of nothing about us without us, as we mentioned, and so happy that Godfrey is here with us today, with mental health advocates, with people with lived experience, human rights organizations, anti-torture organizations, to launch this global campaign, #BreakTheChains, to work together to end this practice of shackling people with mental health conditions in advance of World Mental Health Day on October 10th. And as part of our launch, we released a report today where we've documented this hundreds of thousands of cases in 60 countries across pretty much every continent. I actually interviewed a man in Ghana who was in a spiritual healing center. He was held there for nearly 10 years by a chain to a tree. My colleague met a woman in Indonesia who was crouched in a boarded room, naked, sitting in the dark, behind the family's home in Indonesia for 15 years. She was in that room. And what we found as an organization is horrific. People can spend years, and it's not because families are doing anything intentionally. It's because they don't know how else to cope. And there's really been a failure of governments to provide the kind of mental health services that people want. People are in very unsanitary conditions. They're in degrading conditions. This one man we met in Kenya, he told us he had been chained for 5 years and said the chain is so heavy that it makes him so sad. He sits in a small room, 7 men in this room. He wears only an underwear. He's not given any clothes. He goes to the toilet in a bucket. It's given to him. And he told us, it's not how a human being is supposed to be. A human being should be free. Now, and this happens in state-run institutions. This happens in traditional healing centers. This happens in family homes. People are denied food. They're forced to take medications or herbal concoctions or spiritual baths. They experience physical violence. There are some of cases we've documented in Kenya and in Nigeria where people are caned or whipped. I mean, at the end of the day, let's call shackling what it is. It's torture, and the UN experts agree. In fact, the UN expert on torture has said that shackling is unequivocally amounts to torture. And frankly, if I hadn't, having seen it firsthand, I can attest to that. And while some countries are paying more attention to mental health, and there are some investments, and I think I want to acknowledge the good work that the World Health Organization has done on a quality rights initiative that has been rolled out in a number of countries, including in Ghana, where I've done the most work. There's still no data, and there's still very little coordination and on a regional level or an international level to combat this practice of shackling. And without the data, as I think Godfrey was alluding to, people with psychosocial disabilities are invisible. And the shackling only makes them more invisible because it's usually done in a shroud of secrecy where they're hidden away from anyone else in their communities. And that isolation in itself, in many of the cases of people I've met, they didn't have a mental health condition before they were shackled, because in many cases it's a perception of a mental health condition. Then they clearly will have a lot of trauma after being in those kind of conditions.
Great, thank you. Yeah, those are disturbing statistics, but I want to pull in an audience question. Do you see differences in treatment in countries that embraced a social model of mental health versus a medical model? Do you have any thoughts on that, Shanta?
Yeah, I think it's a good question. I was actually going to talk also about sort of how those investments play out. But most countries still operate under a medical model, frankly. And we're still moving toward having a social or a rights-based model. But there is hope. I know that I laid out a very grim picture, but I do have, there is some hope. And I have a couple of slides that I can share with you and maybe tell you the story of a man named Felix, whom I met. This is Felix. I met him in April 2017 at a spiritual healing center in a town about 3 hours from Accra in Ghana, the capital of Ghana. And as you can see, all he wore was this red cloth that was draped around him, and a chain about 1 meter long was tied around his ankle to this trunk of this tree. That 1 meter was basically the radius of his life. On this site, when I visited, there were roosters running around and there were chickens running around, and yet he was chained, and yet these animals could be free. And it was really, for me, one of the most moving. You can see the second slide. You can see me interviewing him. And it was such a powerful conversation because he knew what was happening, and he knew that it was unfair and in an undignified way to live. But we worked together with local mental health advocates and people with lived experience in Ghana. And after pressure, 2 months later, the government actually sawed the chains off of Felix and 15 others who were in this camp. And I met him a couple of months after that, and you could see a marked difference. It's the next slide you'll see here. And you can see that he's gained weight, he's smiling, he was free. And it meant it means such a difference. And this was back in 2017 when I took this photograph. And I've been visiting Ghana every year, and I've since seen him, and Felix is featured in the work that we published today as well. I saw him last November. And in between that, the government of Ghana actually banned the practice of shackling in 2017. But the problem has been that they haven't actually monitored that ban. So we've seen, every time we go back to Ghana, that there's still people who remain in chains, and there needs to be more enforcement of the ban. The rhetoric is there, but the reality is quite different. So in terms of Felix, however, I think one of the key issues is not only, that when I asked him last November, how are you feeling? He said, I'm feeling good, but what I want is a job. And what he needs is housing, and he needs these basic services. And so when we're talking about investments, whether it's low income or high income countries, it really is important that we don't look at mental health as a solitary amount of medical services that, and this addresses your question. It's about looking at it through a social model lens, looking at it as holistically and comprehensively, and seeing that in addition to counseling and therapies and other supports, there has to be job training, housing, and supports for people to live on their own. I see Godfrey shaking his head and saying, this is what I learned from listening to people like Godfrey telling us, like, this is what we need, and using them as a resource and what we try to do is amplify stories of Godfrey, like Felix's story as well. And what I think has been really encouraging in Ghana is every time I go back, especially the last year, and Devorah, you'll be heartened, I hope, to hear this. I've been visiting the psychiatric hospital since 2011. I've been doing this work for almost a decade. And I've really seen in my last visit about a year ago, a shift in the attitudes. And the people I talked to who were starting to look at mental health as a human issue and not as a medical issue had received the training through this quality rights program that WHO is doing. And I really see that there's an impact. There's people on the ground, the attitudes and their practices are changing. And that's where the investments need to happen in order for there to be some change, some real change. And I'm just going to end with one statistic here that I find quite interesting in terms of investments. We found in our report that governments spend less than 2% of their health budgets on mental health. And in low-income countries, it's about 1%. It's 25 cents per person per year. And in higher income countries, it's just $80 per person per year, which is still not a lot of money. But what's really concerning is that 80% of that money goes to psychiatric hospitals, places that confine, places that also, where we've documented in 25 countries, are places often of abuse, and where, to bring back to COVID, where it's high risk of COVID, given that people are not able to have social distancing, they don't often have access to soap or sanitation or proper hygiene. And yet very few is spent in community-based services. So just emphasizing the importance of shifting, and why the social model is important is really shifting to seeing community services holistically and making sure governments are actually investing there, that the dollars are going there, and where we ensure that those practices are also respecting the rights so they don't end up in chains, but can live in dignity.
Right, thank you, Shanta. And I know we are getting close to the end of our time, but I did want to just throw one more poll out there quickly to measure our audience perception on what is the biggest barrier to investing in mental health. And I'd like to bring Devorah back in if you want to come join us as we wrap up. And Devorah, I guess be curious to hear your perspective on funding and whether having really dedicated mental health programs and funding streams versus integrating it into other programs. And we did have a audience question around how come the mental health support was housed under the non-communicable disease section of the WHO, and shouldn't it be at a higher level? Curious your thoughts on how that funding should be directed. And then we'll close with closing out remarks from the rest of our panelists.
Thank you so much, and thank you for all the panelists. It's been impressive, Shanta, also the report that I was trying to download while listening to you. I think that we could need an entire hour to answer to some of these questions, but if we want to go to the point, I would say that the figures that Shanta just gave us in terms of the funding, we have 2% of the health budget that goes to mental health, and that is not enough. That needs to be increased. then I am not so happy with medical versus social model, because we are one, and we need to have an answer that a service that answer to all our needs, and somebody has to be in charge of or be responsible for the mental health of a person from the medical perspective, as well as from social education, job opportunities, living opportunities, and all of them. So it has to be a comprehensive approach. And similarly, when with more money coming and more money needed, less than $1 a day is the common trend versus the $80 per year that is already very low for high-income countries, as Shanta just said. When we see that the 2% goes only to mental hospitals that treats very frequently in a very bad way, a very small number of people, well, that needs to change. And so whether it is above or under the other conditions, that is not the problem. To me, the problem is that more resources are needed if we want to make sure that the person receives the treatment that deserves, treatment that is respectful of human rights and of at the standards that we all have. There are strategies. Not everybody needs to have thousands of mental health specialists. There are strategies that have been developed based on scientific evidence, alternative options for countries that do not have all those mental health professionals. For example, we have from Zimbabwe, the famous friendship bench that was developed, training grandmothers to provide basic mental health support to people. There are tools available to the quality rights that Shanta mentioned. There are tools to strengthen the capacities of primary care professionals to learn better how to deal with the challenges they encounter. And those are MHGAP, for example, also developed by WHO, but there are many others, and we are not the only ones doing a good job, but there are options. So I think that we are getting to the point when governments can commit, like it is happening in Ghana, saying, okay, we need to change the situation. We need to find alternatives that are working for us in the current context with the current resources, and gradually see how those resources are increased. Last but not least, we also need the support from the international community, because it's 1% of the all international aid that goes to mental health, the health aid that goes to mental health. So it's almost non-existent. And so that is also needed, because we need to maybe push a bit harder and help countries that are committed to find that alternative ways, alternative modalities to deal with this. COVID-19 and what we highlight in this report hopefully serves as eye-opener to many others, saying, okay, if this was the situation before, with COVID-19, the demand may increase. We need to be ready. We need to be prepared and be ready to answer to the situation today and the situation that is coming in next weeks, month. That's it.
Right, well, and thank you for that. And my colleagues maybe can throw up the poll results. And actually, to close, I'd love to kick it over to Godfrey and you know, what would you want to tell your governments and funders about why they need to invest more in mental health? What would be your final call to action?
Thank you very much. Like some of my colleagues have just said, for the case of Uganda here, really we still have gaps in funding. You find that 1% of the Ministry of Health budget is not allocated to mental health services. And that 1% goes towards payment of salaries for workers, but also towards procurement of drugs. The challenge is our policy makers seems not to appreciate the role of community mental health services. So they think that they're only using the medical model, which I think is very wrong. We need to invest a lot in community mental health services. We need to do a lot around advocacy. I think the challenge we are having and why we still have stigma around mental health challenges One is lack of information. And it's through us investing in community mental health services that we can address the issue of ignorance, that we can increase people's understanding about mental health challenges, but also making them to understand ways on how they can support those who are going through mental health difficulties. Yes, that's what I can say. So I think like never before, the COVID-19 has exposed us. And I would call upon the government, but also the international community, to really think of investing into community mental health services. Thank you very much.
Yeah, thank you. And so our poll results, looks like we're preaching to the choir here, or we have some converted audience members, but by and large, the number one barrier to investing in mental health is a low priority for major donors, due to competing priorities. But second is just lack awareness of the scope of the issue, which I think Godfrey just underscored there. I know we could probably talk for another few hours on this. This is a big topic, right? So again, I thank the Global Mental Health Action Network for giving us this time to come together to raise awareness around this issue. We certainly will be continuing the discussion here at Devex, and I appreciate all of our colleagues here who took the time to come share their insights with us. We will be sharing a link to the WHO report, the Break the Chains report that Chantal mentioned, and our follow-up if you weren't able to find the links in the chat today. But again, thank you to everyone who participated, and to our guests, and to the Global Mental Health Action Network for your leadership on this important issue. If you'd like to join their network, again, we'll share their link in the chat. And thank you to our audience for joining us today. I hope you're able to take some time to focus on your own mental health, and encourage you to look into ways you can get involved, and as we gear up to October 10th. So again, thank you everyone for joining us.
Thank you.
Thank you.
Thank you.